Did you know that your kidneys can send you warning signs when they are not functioning correctly? These signs are crucial indicators calling for attention and care. In today's video, I'll walk you through 5 key signs that suggest your kidneys might be struggling, and I'll also provide some vital tips on how to prevent or address these issues. Curious about the foods that can supercharge your life and fuel your body with vitality? Subscribe to my YouTube channel, Home Nutrit, and join me on a quest to explore the wonders of nutrition for a healthier, happier you. When kidneys begin to fail, they can lead to a series of health problems affecting different parts of your body. Understanding these signs can help you take early action to manage your kidney health. 1. Swelling in your legs or feet. One of the first signs that your kidneys are not working properly is the swelling of your legs or feet. This condition, known medically as edema, is due to the accumulation of excess fluid in your body, which your kidneys are unable to filter out. What is edema? Edema is a medical term for swelling caused by excess fluid trapped in the body's tissues. It is most commonly seen in the legs, ankles, and feet, where it can cause noticeable swelling, but can also occur elsewhere in the body. How does it relate to kidney function? The kidneys play a critical role in regulating body fluids and electrolyte levels. They do this by filtering blood, removing excess water and waste products, which are then excreted as urine. When your kidneys are not functioning properly, due to damage or disease, they can't perform this filtering process effectively. As a result, fluid isn't properly excreted from the body and instead builds up in the tissues, leading to edema. Symptoms and consequences of edema. The swelling from edema can range from mild to severe and might make the skin feel tight, stretched, and uncomfortable. It can limit mobility, making it difficult to walk or move the affected parts of the body freely. Beyond discomfort, edema in the legs and feet can be an early indicator of more serious health issues. It signals that the kidneys are not managing to keep the body's fluid levels in balance, which can have cascading effects on other bodily systems. For instance, the excess fluid can increase blood volume, which in turn raises blood pressure. Prolonged high blood pressure is a risk factor for heart disease and can strain the cardiovascular system. Thus, edema not only affects the area where the swelling occurs, but can also contribute to broader health complications. Why it's important to seek medical advice. Persistent swelling should not be ignored. Consulting with a healthcare provider is crucial for several reasons. A doctor can perform tests to determine the underlying cause of the edema. These might include blood tests, urine tests, and imaging studies to assess kidney function and look for other potential problems. Once the cause is identified, the doctor can recommend appropriate management strategies. These might involve changes in medication, dietary adjustments, lifestyle changes like increasing physical activity, or in some cases, more advanced treatments if the condition is severe. Understanding the cause and treating the underlying issue, not just the symptoms, is essential for preventing further health complications and improving overall well-being. 2. Persistent fatigue or weakness. Why kidney problems cause fatigue? Kidneys play a crucial role in filtering and removing waste products and excess fluid from your blood. They also help to maintain a balance of minerals and electrolytes in your body. When your kidneys are compromised, due to conditions like chronic kidney disease or acute kidney injury, they lose their filtering ability. This inefficiency leads to the accumulation of toxins and fluids in the blood, which should otherwise be eliminated. The buildup of these toxins can have a direct and debilitating effect on your overall energy levels, leading to profound fatigue or weakness. This isn't just ordinary tiredness. It's a type of exhaustion that persists even after rest and can severely limit your ability to handle routine activities or exert yourself physically. Connection to anemia. One significant factor contributing to fatigue in kidney disease is anemia. Anemia occurs when your body doesn't have enough red blood cells, which are crucial for carrying oxygen throughout the body. In healthy individuals, the kidneys produce a hormone called erythropoietin, EPO, which signals the bone marrow to make red blood cells. However, if your kidneys are damaged, they produce less EPO, leading to fewer red blood cells and less oxygen reaching your tissues and organs, resulting in fatigue. Symptoms of kidney-related fatigue. The fatigue associated with kidney disease is usually severe and can impact all aspects of life. You might find it hard to concentrate, feel unusually weak, have difficulty engaging in physical activities, or feel tired even after a full night's sleep. This type of fatigue can also affect your mood and mental health, contributing to feelings of depression or anxiety. Why it's important to seek medical attention. Persistent fatigue due to kidney problems is not something that can be treated with ordinary rest or sleep. It is important to see a healthcare provider to correctly diagnose the cause of the fatigue. The diagnosis may involve blood tests to check for waste products in the blood, tests for anemia, and assessments of kidney function treatment options. Treatment for fatigue related to kidney disease will focus on addressing the underlying cause of the kidney dysfunction and managing the symptoms of anemia if present. Possible treatments can include medications to manage symptoms of kidney disease or to treat anemia, such as erythropoiesis-stimulating agents, ESAs, which help your body produce more red blood cells. Dietary changes. Eating a diet rich in iron, folic acid, and vitamin B12 can help combat anemia and improve energy levels. Dialysis. In cases of severe kidney dysfunction, dialysis may be required to help filter the blood. Kidney transplant. In end-stage kidney disease, a transplant may be considered. Managing kidney health. In addition to medical treatment, managing overall kidney health through lifestyle changes such as maintaining a healthy weight, quitting smoking, managing other health conditions, like diabetes and hypertension, and regular monitoring can help improve kidney function and reduce fatigue. If you're experiencing persistent fatigue, it's crucial to consult with your healthcare provider for a proper diagnosis and appropriate management to improve your quality of life. 3. Nausea or vomiting. These symptoms are particularly common when kidney function is severely impaired. The buildup of toxins in your bloodstream, a direct result of diminished kidney function, can lead to nausea and vomiting. These symptoms are not only uncomfortable, but can also lead to dehydration and significant electrolyte imbalances, further complicating your health situation. Regular or severe episodes of nausea and vomiting should prompt a visit to your doctor, who can determine the cause and suggest effective treatments. Let's explore in more detail how severely impaired kidney function can lead to nausea or vomiting, along with the consequences of these symptoms and the importance of medical intervention. How kidney function impacts nausea and vomiting. The kidneys are essential for filtering waste products from the blood and excreting them in urine. When kidney function is severely impaired, due to conditions like chronic kidney disease, acute kidney injury, or end-stage renal disease, the kidney's ability to filter blood diminishes. This inability leads to the accumulation of toxins and excess fluids in the bloodstream, a condition known as uremia. Uremia can affect various body systems, including the gastrointestinal tract. The buildup of toxins such as urea and creatinine can irritate the stomach lining and the brain's centers that control nausea and vomiting. This irritation is what typically triggers these symptoms in individuals with significant kidney impairment. Consequences of nausea and vomiting. Due to poor kidney function. While nausea and vomiting might seem like straightforward symptoms, they can lead to more severe health issues, especially if persistent. 1. Dehydration. Vomiting leads to a direct loss of fluids, which, if not adequately replaced, can cause dehydration. Dehydration can further deteriorate kidney function, creating a vicious cycle where poor kidney function leads to more dehydration. 2. Electrolyte imbalances. Along with fluids, essential electrolytes such as potassium, sodium, and chloride are also lost during vomiting. Electrolyte imbalances can disrupt heart rhythms, muscle function, and even nerve responses, which can be dangerous if not addressed. When to seek medical attention. Regular or severe episodes of nausea and vomiting are not only distressing, but can also indicate a severe underlying health issue. It's important for individuals experiencing these symptoms frequently to see a healthcare provider. The steps involved typically include diagnosis. The doctor will perform a series of tests, such as blood tests, to check for high levels of toxins indicating kidney dysfunction, and imaging tests to visually assess the kidney's condition. Treatment. Addressing nausea and vomiting in the context of kidney disease involves treating the underlying kidney condition along with specific treatments to control the symptoms. Treatments might include medications to reduce nausea. These can help control the brain's response to toxins that trigger nausea. Adjustments in fluid intake. Ensuring proper hydration is crucial, but it must be carefully managed to not overload the kidneys. Dialysis. In cases where kidney function is significantly impaired, dialysis might be necessary to filter the blood mechanically, thereby reducing the toxin load and alleviating symptoms. Dietary changes. Modifications in diet, especially reducing protein intake, can decrease the production of uremic toxins. Preventive measures. For those at risk of kidney disease or those already diagnosed, regular monitoring of kidney function and adherence to medical advice are crucial to prevent the progression that might lead to severe symptoms like nausea and vomiting. Maintaining a healthy lifestyle with adequate hydration, diet, and avoidance of nephrotoxic substances, like certain medications and alcohol, can also help preserve kidney function. Ultimately, nausea and vomiting due to kidney dysfunction are serious symptoms that require medical evaluation and treatment to manage effectively and prevent further complications. 4. Changes in urine appearance or frequency. Why urine appearance and frequency matter. Urine is the product of blood filtration by the kidneys, carrying away waste products and excess substances that the body doesn't need. Any changes in urine can be early signs of kidney dysfunction or other conditions affecting the urinary tract. Changes in urine color. Normal urine color ranges from pale yellow to amber, depending on hydration levels. Here are a few deviations and what they might indicate. Darker urine, often a sign of dehydration, but can also indicate the presence of high levels of waste products like urea and creatinine when the kidneys are not filtering effectively. In some cases, dark urine can also be due to the consumption of certain foods, medications, or the presence of blood, hematuria. Very pale or clear urine. Usually a sign of overhydration, but frequent very pale urine could indicate that the kidneys are not concentrating urine properly, possibly due to kidney disease. Changes in urine clarity. Urine is typically clear. If it becomes cloudy, it could indicate infections. Cloudy urine can be a sign of a urinary tract infection, UTI, or kidney infection. Crystals or stones. Urine that consistently appears cloudy might also suggest the presence of kidney stones or crystalline substances. Changes in urination frequency. Alterations in how often you need to urinate should not be ignored. They can include increased frequency, often occurs with infections like UTIs or with conditions like diabetes. It can also be a reaction to certain medications or dietary choices. In kidney disease, increased urine output might occur when kidneys fail to concentrate urine properly. Decreased frequency or difficulty. Urinating could indicate blockages in the urinary tract, such as from kidney stones or issues with kidney function where urine production is reduced. It might also signal prostate issues in men. 5. Itchy skin. Itchy skin, medically known as uremic pruritus, is a common but often overlooked symptom of kidney failure. This symptom arises from the kidney's inability to adequately filter waste products from the blood, leading to their accumulation in the body, including in the skin. Let's break down this condition in more detail to better understand its implications and necessary actions. What causes itchy skin in kidney failure? In healthy individuals, the kidneys filter waste products and excess substances from the blood, which are then expelled from the body through urine. When the kidneys fail, due to conditions like chronic kidney disease, CKD, or end-stage renal disease, ESRD, their filtering capacity diminishes. This leads to a buildup of uremic toxins, such as urea, creatinine, and others in the bloodstream. These toxins can deposit in the skin, causing irritation and severe itching. Symptoms and impact on quality of life. The itching can vary in intensity and may become worse at night, which can significantly disrupt sleep and consequently affect daily functioning. Commonly, the itching is more pronounced in the lower extremities, but can affect any part of the body. The skin may appear dry, flaky, and irritated. Repeated scratching in response to the itching can lead to further skin damage, such as thickening and infection, exacerbating the discomfort and potentially leading to more severe skin conditions. Why it's critical to seek medical attention. Persistent or severe itching should prompt a visit to a healthcare provider because diagnosis. It's important to confirm that the itching is indeed related to kidney issues and not other common causes such as allergies, dermatological conditions, or other systemic diseases like liver disease or thyroid disorders. A healthcare provider might order blood tests to check kidney function and levels of waste products in the blood. Skin examinations and other diagnostic tests might also be conducted to rule out other causes. Treatment. Managing uremic pruritus involves treating both the symptom and its underlying cause. Treatment strategies might include topical treatments, moisturizers to combat dryness, topical corticosteroids to reduce inflammation, and creams containing capsaicin or pramoxine to alleviate itching. Medications. Antihistamines can provide relief from itching, though they may be less effective for uremic pruritus. Gabapentin and pregabalin, originally used for nerve pain, have been effective in treating severe itching in dialysis patients. Phototherapy. Exposing the skin to specific types of ultraviolet light can help reduce itching. Managing kidney disease. Enhancing dialysis efficiency, if the patient is already on dialysis, can help remove more toxins, potentially reducing itching. In cases where dialysis isn't yet instituted, evaluating the need for starting dialysis might be considered. Preventive care and monitoring. Regular follow-up with healthcare providers is crucial for patients with kidney disease to monitor their condition and adjust treatments as needed. Lifestyle adjustments, including skincare regimens that focus on hydration and avoiding irritants, can also play a role in managing symptoms. Addressing itchy skin due to kidney failure is important not only for comfort, but also for overall health and quality of life. Effective management of kidney function and symptoms associated with its decline can significantly improve patient outcomes and well-being. Recognizing these signs is not just about symptom management, but is also crucial for taking proactive steps towards maintaining or improving your kidney health. If you observe any of these symptoms, or if something else about your health seems off, consult a healthcare professional without delay. Also, feel free to share your experiences or tips on kidney health in the comments below. Let's foster a supportive community focused on wellness and proactive health management. Curious about the foods that can supercharge your life and fuel your body with vitality? Subscribe to my YouTube channel, Home Nutrit, and join me on a quest to explore the wonders of nutrition for a healthier, happier you. We look forward to bringing you more useful health content that can help you live a vibrant, healthy life. Until next time, take care of yourself and each other.